S. Subjective patient history, symptoms and complaints from parents or older children. Chief complaint and symptom onset, feeding, sleeping patterns. Developmental milestones, behavioral concerns. O. Objective clinical findings and measurements, vital signs, temperature. Heart rate, respiration. Growth charts and weight physical exam findings. Lab results. A. Assessment, nurses or physicians' clinical judgment. Clear diagnosis or differential diagnosis. Age-appropriate conditions, developmental considerations. P. Planned treatment and follow-up recommendations, medications. Dosage and instructions, care instructions and nutrition advice, follow-up plans and referrals. Define assessment scope, evaluate SOAP notes for clarity, completeness, and accuracy. Ensure compliance with pediatric documentation guidelines, HIPAA, AAP standards. Identify missing or inconsistent information in patient records. Select eAuditor checklist, review, if each SOAP component is properly documented. Assess legibility and medical accuracy, verify adherence to facility protocols, gather relevant data, access pediatric medical records, previous SOAP notes, and facility documentation policies. Subjective assessment, verify documentation of patient history and chief complaint, symptom onset and progression, feeding and sleeping patterns, developmental milestones, behavioral concerns reported by parents, guardians, objective assessment, confirmed documentation of vital signs, temperature, heart rate, respiration, growth charts and weight measurements, physical examination findings, laboratory and diagnostic test results, detailed observations, skin color, hydration, respiratory sounds. Assessment. A. Evaluation review. If assessment logically follows subjective and objective findings, check for clear diagnosis or differential diagnosis. Ensure age-appropriate conditions are considered, developmental delays, common pediatric illnesses, vaccination status. Plan. P. Evaluation. Verify if prescribed medications, dosage, and administration instructions are included. Ensure care instructions, hydration, nutrition advice, and follow-up plans are clear. Assess whether necessary referrals, pediatric specialists, speech therapy, are documented when needed. The assessment and plan sections are critical for continuity of care and must clearly connect to the documented symptoms and findings. These sections should demonstrate clinical reasoning and provide actionable next steps for both healthcare providers and families. Automated report generation. Generate SOAP note assessment reports instantly through eAuditor, including photos if applicable, compliance ratings, and evaluator comments, documentation gap identification. Highlight missing subjective data, incomplete assessments or unclear treatment plans, and recommend training sessions for staff on improving pediatric SOAP documentation. Compliance analysis. Evaluate adherence to pediatric documentation standards, regulatory requirements, and facility protocols to ensure legal and clinical compliance. Implement improvements, assign corrective actions in eAuditor to specific staff members, notify nurses, physicians, or administrators about inconsistencies. Implement mandatory refresher training on SOAP note accuracy. Monitor progress schedule. Regular follow-up assessments to maintain compliance. Update documentation protocols based on recurring issues. Provide education on effective pediatric SOAP. Note documentation. Regular documentation audits. Perform monthly or quarterly assessments to track improvements and revise SOAP note templates to meet evolving pediatric care needs. Staff education. Provide ongoing training on pediatric-specific documentation requirements and best practices for comprehensive SOAP notes. Performance tracking. Use eAuditor to monitor documentation, quality metrics, and identify trends in compliance over time. Process refinement. Continuously update assessment criteria and documentation standards. Based on regulatory changes and clinical best practices. A pediatric SOAP note assessment. Using eAuditor ensures structured, accurate, and regulatory compliant patient documentation, enhancing communication, improving patient care, and ensuring compliance with medical documentation standards.